Hi, my name is Hannah Erba and I will be showing you today how to use a Low-Tech AAC board with questions on it. A Low-Tech AAC device is a device that requires no battery that allows an individual to communicate with others. This board I'm going to show you today was created with the intent of allowing an individual who's staying in the hospital to point to questions that they may have during their stay. This method of communication is called direct selection, and direct selection access means that the client will point their finger to indicate their question or their message of intent. One thing to note while using this board is that an individual must have the ability or receptive language skills to understand the WH questions that they are asking. Speaking is not required. An individual can simply point to the question they are asking, and then this board can also be used as a way for others to ask the individual questions if needed. Please note that this is just one way to allow for communication with healthcare professionals during a hospital stay. There are other ways of communicating, and this can be used in addition to other boards. All right, so let's get started. So first, you'd want to model how to use this board. So for example, you'd point and you'd say, "What is for breakfast, lunch, or dinner?" So you'd point, and then the individual who's communicating with the person pointing to the board could ask and clarify, "Oh, were you pointing to this question? What is for breakfast, lunch, or dinner?" And then that individual could also clarify their question by pointing to yes or no on this board as well. And so some of the questions that I have included on this board include, who are you? What day? Why? When? Will it hurt? How long? What's next? Where? Where is my family? What happened? How? Will you? And then where is my? And this has a phone, keys, glasses, a purse, and a watch on there. What is for breakfast, lunch, or dinner? So this was created with like I said, like the intent of an individual to ask questions if they are unable to speak during their hospital stay. It can be used in addition with a whiteboard if they have the ability to write their question, if they have more info to add as well. And then down here in the corner we have yes and no, which can be used for a variety of different ways of communicating with hospital staff. And so if you were looking for additional communication support, please contact your speech language pathologist to learn more about AAC supports and other devices. Like I said, this was a pretty low-tech board, and the individual would just need to learn how to point to the question that they are asking in order to effectively communicate with nurses or other hospital staff.